don't have to have it all together.
Hello, today I want to talk about what my genetic amniocentesis was like and what you might be able to expect if you've decided to get one done or your doctor has recommended for you to get one. So, full disclosure, we are in Alberta and we were at a high-risk maternity clinic that deals with high-risk cases just because at our NT scan, it appeared as though baby had some choroid plexus cysts, and we were doing follow-ups to rule them out. So we had already ruled those out as any possibility, and they just invited us back for anatomy scan because we had already been going to see them and it wasn't a problem for them. So an amniocentesis is a test of the baby's amniotic fluid. So what they do is they collect about 30 milliliters of amniotic fluid, which is about 2 tablespoons, and they run it for tests. So they check the size and number of chromosomes. This can rule out things like Down syndrome, for example. The specific type of test we had was an RAD amniocentesis, which just means the test can be completed much faster. So here is what to expect the actual procedure. So for the actual procedure, I was led back into the same ultrasound room that I was in previously. They have you lie down, you lift up your shirt, and you pull down your pants, just kind of like you would do for an ultrasound. And then you have a ultrasound technician and a nurse in there with you. So the ultrasound tech does a quick scan of the baby while they're waiting for the doctor, checks the baby's heart rate, checks for movement and everything to make sure baby's okay and to create a baseline. And then once the doctor comes in, he will spread, I don't know what it's called, but it's like that orangey antibacterial like stuff that they put on you before you have surgery, right before they cut you open. So he prepares the area that way, and he did it all over my tummy. The nurse actually called him the drencher in terms of using so much of the fluid because he's really like a germaphobe, which is nice. And the ultrasound tech keeps the wand on and she checks for position of the baby, and they figure out where the best place to place the needle is, and the ultrasound probe is on your tummy the whole time. The nurse then has the vial that collects the fluid, and the doctor comes, has a needle, and it's all sterile, and the needle is about, I think it was about that long. I honestly wasn't really looking, like, I don't know how to, for scale, it was about that long, but it's not a big needle in terms of like that way. And after double checking to make sure the site that he wants to place it is free from the baby, he uses the visuals from the ultrasound to insert the needle. So this was probably the scariest part for me because I didn't know what to expect, but it actually didn't really hurt. It feels like, it's the same level of pain that you feel when you get blood taken for blood draws, but you feel it go through your skin, and then you kind of feel it go through your uterus like afterwards. So it's not just like one layer of skin the needle's going through, it's going through skin and then your uterus, and you do feel it, but it doesn't hurt, if that makes sense. And then when he starts sucking out the fluid, and he did it very, very slowly because they wanted to make sure they just got the 30 milliliters. They didn't want to take any less or any more than that. And when they're doing that, you have to stay completely still, which isn't too bad because it doesn't hurt. It's just scary in your mind because you're thinking, what's happening? I've never had this done before. And you feel a slight pressure as they're as they're sucking out the fluid. And then once they have enough fluid, he quickly pulled out the needle, and I didn't even bleed. It didn't cause me to bleed at all. And then he left because he had done his job, and the ultrasound tech scanned my tummy again to check where the needle had gone in through the uterus to make sure everything was okay, which it was. And she also checked on baby once again to make sure baby wasn't in any kind of distress, which baby wasn't. Baby probably didn't even notice that anything was going on, to be perfectly honest with you. And then the nurse showed me the vial, I made sure that my name was on it and everything was correct on it. So amniotic fluid, it's a clear fluid, but it can be tinged yellow, kind of like pee, because that's essentially what amniotic fluid is. It's the baby's pee. Yeah. So after the test, I was given a like post-care instruction sheet, and I was not supposed to lift anything or do any strenuous activity for 1 to 2 days afterwards. No sex 2 days afterwards, and to keep an eye out for any gushes of fluid, blood, or amniotic fluid. Normal like discharge was like expected. Also regular like period cramping, they said I could expect some of that and just to take Tylenol. I didn't personally have any cramping. I just had a little bit of soreness where the needle went in, but I always have that when I get blood taken, so I was expecting that. There's a small risk of infection, and that's why they want you to check for, like, if you develop a fever, you're supposed to go into the hospital. Anything like that, anything that you feel isn't normal for you, they want you to go into the hospital, which I didn't experience myself. And overall, the risk of miscarriage for amniocentesis in general is about 1 in 200. But because I was at a high-risk clinic and they see a lot of patients who get amniocentesis done, the risk for the clinic was at about 1 in 500. So that's something to keep in mind as well. And it took the tests that we got done on for the amniocentesis, it takes 2 business days, but because we got our test done on a Thursday, we didn't hear the news back until Tuesday. So all in all, I'm glad we got it done, because we were able to rule a lot of things out, and it gave us peace of mind, and it would have given us peace of mind either way. Don't be afraid of other people's experiences, especially coming from, because generally when you have to get an amniocentesis done, people suspect that something is wrong, and more times than not, the person who is that one, like that 1 in 200 or that 1 in 500, will be the one that actually shares their story. And it goes for the same thing of people who have that risk of 1 in 76. You hear more about the people who get the positives, or I guess the results they didn't necessarily want, than the people who everything's normal and they move on with their pregnancy. So this was a long video, but I hope it was helpful. If you are new here, be sure to hit that subscribe button and the notification bell, because we don't upload very regularly. We're trying, but we don't. Thanks for watching. Bye, guys.